If you don't know anyone who has been diagnosed with autism, then it may be a difficult disorder to understand. The condition itself is still somewhat of a mystery to physicians as there is no definite factor that causes autism.
Autism is a pervasive developmental disorder in children where they have problems and delays in social interaction, communication, and behavioral problems. They are generally socially immature. They don't communicate like we communicate. They sometimes talk to themselves. They have repetitive things that they say over and over again. That's called echolalia. They have repetitive movements. They have behavioral problems, all related basically to the fact that they don't perceive life and other people like we do. They perceive themselves, and this is an oversimplification, but they perceive the world to be involved with them alone, and there really aren't distinct other people involved. These are the true autistic children that have autism to a relatively moderate to severe degree. Therefore, if you're the only person around, why do you need to develop socialization skills? Why do you need to develop language skills? Because there's nobody to talk to. Now, there's a range of involvement so that you can have pretty bright people that have autistic tendencies, and you can have profoundly autistic children that are doing what I just described. They just don't perceive the world as a normal child would. They don't feel the need to communicate. They don't feel the need to socialize. They don't feel the need to behave. So on some days they may be great, and on some days they may be out of control. The brightest of these children can be in a regular classroom, and that can go all the way down to somebody who's in special ed most of the time. Now, something else that they can have is attention deficit disorder, which is a totally different subject, but some children with autism can have that. Therefore, there is medication for that part of it, but there's no real medication for autism except therapy in all those three areas. Autism involves around 1% of the population, a larger percent if you include everybody who has autistic tendencies. Now there is a lot more research now into autism, so you're going to pick up some people that are have very soft signs, and yet they may get labeled as autistic or autistic tendencies or autistic spectrum disorder. So that's why you may read statistics that say there's a higher incidence of it than this 1% that I'm quoting you from the textbooks. Yeah, the causes are unknown. There's nothing that points toward anything. Some years ago, there was a doctor in England named Wakefield. He proposed a theory that autism was related to the vaccination measles, mumps, rubella, which is commonly called MMR. He based that on findings on intestinal biopsies of measles virus in a higher frequency in autistic children than in children who weren't autistic. That has been proven to be absolutely false over and over and over again ad nauseum. He's actually been discredited. He lost his license. So there is absolutely no data, not one legitimate piece of data, that links the shot or the vaccine MMR, which is given at 15 months old, and again at 5 years old, to autism. Why then do people still believe that there may be a link? Because there's some people who say, well, I really think there is. One of the more famous people was Jim Carrey's wife. I forget her name. Her child had autism. She was convinced that it was linked to the MMR. Well, remember, socialization, communication. When do you start communicating? Somewhere around 15 months to 2.5 to 3 years. That's when your language development starts. When do you start socializing? Well, sooner than that, but really with other people at about in the second year of life. So if your child is diagnosed somewhere between 15 months and 3 years of age, which most of them are with autism, you think back and you say, this started maybe after that 15-month vaccination with MMR. So there are still some believers. There's another chemical called thimerosal. Thimerosal is a preservative that used to be in vaccines. We used to buy vaccines in a 10-dose vial, and there had to be a preservative in there to keep that fresh. Well, that preservative was thimerosal for a long time until they discovered that it had a little mercury in it. And so then people started trying to relate that to autism. Again, the studies showed beyond question that there is no relation. So it got a bad rap. Autism, the MMR and the thimerosal got a bad rap about autism, but it actually turns out scientifically to not be related. But you still hear it talked about.
Having a child with a condition like autism can be rough, and it requires the help of not only the mother, but the entire family.
Just like anything else, a developmentally delayed child, a physically handicapped child, the family really has to participate. And you talk about a burden. It can really be a burden. Can you imagine a mother who has a 2-year-old normal child and a 5-year-old autistic child? Who's going to get the attention? It really is a burden on the family, and although these children are loved just like all the other disabled children, it really requires a lot of time. So the treatment is all-inclusive, and every member in the family really has to be able to know how to handle it so that the child gets the most stimulation that they can get.
There is no cure for autism, but progress is being made to help adapt to autistic children's needs in several areas, not just medically, but socially and academically.
As we learn more about it, there's special people there are people that are specializing just in teaching autistic children. The school systems have got a lot of, say in the last 10 years, maybe even in the last 5 years, are using more advanced techniques to deal with these children. You learn what they react to, what they react positively to, and what they react negatively to. You can have a perfectly calm autistic child who all of a sudden just flips off and starts having behavioral problems. They call that stimming, S-T-I-M, stimming. So yes, there's all kinds of new techniques that are being developed by these specialized people, not just doctors, but social workers, people who are interested in autism. A lot of autistic organizations around the country, parent-formed, teacher-formed, special ed teachers. Yeah, there's all kinds of new techniques that help these children. So their prognosis is a lot better now than it used to be.
There are also other variations of autism, like Asperger's.
Asperger's is a side diagnosis of autism. It's basically exactly the same thing, except their cognitive function is normal. Like a child who has an IQ high enough to where at kindergarten they're reading in the 3rd grade level, but they have autistic tendencies in socialization and communication. That person who has normal cognitive function, normal learning abilities, would be called Asperger's. For some reason that I'm unaware of, it's becoming a less popular term. So I don't know exactly why that is, but that used to be the name that they used to describe children who were autistic but with normal learning abilities.
There is a list of 23 questions developed by the American Academy of Pediatrics that will help you determine if your child may have autism. Some of the questions include: does your child show an interest in other children? Does your child seem oversensitive to noise? Does your child respond to their name when called? Does your child smile in response to your face or your smile? For more information on the complete list and on autism in general, consult your pediatrician.